Hey guys, it's Matt. I'm jumping in here real quick to let you know before the show starts that my PayPal link, my BitChute link, is going to be the first comment pinned underneath the video now. It will no longer be in the show description. Also, there's a huge push onto Parler right now that's being done by most of the political right in lockstep, if you'll allow me the word. So I would suggest getting a Parler account, which I will also link to in that same comment. After I pin that comment, underneath that, I will put the links to any of the source material that I used in that video. All right, guys, on with the show. Now, I've already done an episode on the nursing home situations, but I told you that we would probably have to revisit this, and we're going to. Now, it seems the governor of New York wants to make this whole situation political. And how does he want to make it political? By saying that other people are making it political. Now, the first thing I wanted to do in this episode was get the guidance that Cuomo released on March 25th, saying that nursing homes must take in the CV patients or they would be fined. However, I went to the page that I got the document off of the first time, and lo and behold, it's a dead link. The dead link page says this might be what you're looking for. It links you to a document on safety measures to prevent against transmission of COVID-19 at polling stations. Now, why in the hell would New York State remove that guidance? Well, it doesn't take too long to find out. A quick pop over to Business Insider. Governor Cuomo's controversial order requiring nursing homes to admit CV patients was reportedly removed from New York's health website. That's right, it was. Which all this is just funny to me because there's a certain sect of Americans that just don't understand how the internet works. And I guess the state of New York is one of them. You can't just remove something from the internet. It stays there forever. Seems like that and the Streisand effect, they just don't understand. And we'll read the pertinent part, underlined. No resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of CV. Nursing homes are prohibited from requiring a hospital resident who is determined medically stable to be tested for CV prior to admission or readmission. So let's get this straight. Not only was he forcing them to take the CV patients in, but the nursing homes themselves were prohibited from even testing them. Now that's on March 25th, and one would think the governor would know what the policy was. He definitely knew nursing homes were a problem.
504 in hospitals, 36 in nursing homes. Nursing homes are the single biggest fear in all of this. Vulnerable people in one place. It is the feeding frenzy for this virus. Despite everything we can do and the best efforts of people who are working in those nursing homes who are doing just a fantastic job.
And Mr. Cuomo is certainly correct in what he said just then. The problem being the long-term care facility in King County, Washington State. Because the CDC had already done a comprehensive study on that original infection in the U.S. and released these results on March 18, 2020. And as always, guys, I will link you up in the description. But the important part of this report is right here, released March 18th. These findings demonstrate that outbreaks of CV in long-term care facilities have a critical impact on vulnerable older adults. It then goes on to lay out what a state should do in order to protect their target population. And all this is fine and dandy. The reports are great, but the problem that's really not letting Mr. Cuomo off the hook is common sense. Everyone with even an ounce of common sense knows that the first thing that they should do in regards to long-term care facilities is prevent CV patients from getting into the facility. And they did that according to visitors, according to workers. They had PPE. They did everything that they could do, except they allowed CV patients to be moved in. Now, all this considered, a few days later at his next briefing, Cuomo tries to act like he has no idea what's going on with nursing homes.
Positive for the virus, are you allowed to be admitted to a nursing home is the question.
Readmitted.
Or readmitted.
Yeah.
It's a good question. I don't know.
The policy is that if you are positive, you should be admitted back to a nursing home. The necessary precautions will be taken to protect the other residents there.
Now we can sit here and pretend with Mr. Cuomo that he didn't know, and we'll say we didn't know. Nobody knew. But the problem is, around the same time, Governor Cuomo was writing into the state legislation protections for the nursing home community. Because you got to remember, they're donors too, and they need protection. If you're going to start sending us CV patients and not giving us guidance, the least you could do is give us some legal protections. And he did. Now, we were told the reason why all this was going down was because we absolutely needed the hospital beds. We were terrified of overflow from all these CV patients. Except when the USS Comfort left, it left having had treated fewer than 200 patients. And the field hospitals that the Army built, they went largely unused. The overflow problems that we anticipated based off of that horrid model just never materialized. So the policy being for overflow reasons just doesn't match up for me. I found a recording from April 23rd. They don't have this one on video. And Cuomo talks about the whole situation, and I think you could pick out what the problem is.
Nursing homes, they are our top priority. They have been from day one. Remember how the nursing home system works. They are private facilities. They get paid to provide a service. They get regulated by the state government. There are certain rules and regulations that they must follow, and we put in additional rules and regulations on nursing homes in the midst of this crisis. Staff must have appropriate PPE. They must have their temperatures checked before they come into the facility. There are no visitors who are coming into the facility, which is a tremendous hardship, but it's necessary to protect public health. If they have a COVID positive person in the facility, that person has to be in quarantine. They have to have separate staff for the COVID residents versus the non-COVID residents. If they can't care for the person in the facility, they have to transfer the person to another facility. The nursing home is responsible for providing appropriate care. If they cannot provide that care, then they have to transfer the person to another facility. They have to notify residents and family members within 24 hours if any resident tests positive for COVID, or if any resident suffers a COVID-related death. That is a regulation that they have to follow. And they have to readmit COVID-positive residents, but only if they have the ability to provide the adequate level of care under Department of Health and CDC guidelines. If they do not have the ability to provide the appropriate level of care, then they have to transfer that patient. Or they call the Department of Health, and the Department of Health will transfer that patient, right? But that is how the relationship works. The state has very strict guidelines on privately run facilities. They get paid to take care of a resident. That resident, that patient must have a state-directed level of care. If they cannot provide that, they can't have the resident in their facility, period. Those are the rules. We're going to undertake an investigation of nursing homes now to make sure they're following the rules. It's going to be a joint Department of Health and Attorney General investigation. But those are the rules. They get paid to take care of a resident, and they have to do it in accordance with state rules. And if they don't, we will take appropriate action. And the State Department of Health and the Attorney General are going to be commencing an investigation to make sure all those policies are in place and being followed. If they're not being followed, they can be subjected to a fine or they can lose their license. It's that simple.
You hear that? It's just that simple. So what did you hear in that? I'll tell you what I heard. It goes a little bit like this. The state of New York subsidizes nursing home patients. And if that nursing home patient is in the hospital being cared for and the nursing home is still receiving that state money, well, New York State can't have that. They're paying the nursing home already to take care of this person. So if they can't take care of that person, then they need to transfer that person to another nursing home, which is also being subsidized by the state government. Understand, this is about keeping money separated. It was all fiscal. I mean, just think about that. They're denying people the right to visit their loved ones based off of a possibility that they might be infected. And yet, at the same time, they are intentionally loading CV patients into the place through the back door. The whole thing truly is disgusting. But by May 20th, Cuomo had his story together. And who's he going to blame?
Look, this is a political season. I get it. I have refrained from politics. I'm not going to get into the political back and forth. But anyone who wants to ask why did the state do that with COVID patients in nursing home, it's because the state followed President Trump's CDC guidance. So they should ask President Trump. I think that will stop the conversation.
Are you fudging the numbers? Because that's an accusation that you're facing, that you are changing the numbers to make...
Well, let's go back. Let's do one at a time.
Okay.
Your first point, why did the state do that? Because the state followed President Trump's CDC's guidance. Okay? That's that answer. No numbers were changed.
When it comes to the whole nursing home situation, I'm not going to get into the political back and forth and play politics. I was following Trump. And I tell you, I try to stay away from these fact checkers, but when you get somebody on the other side of the aisle getting a mostly false rating, you best believe it's false. That means it has not a shred of truth to it. Mostly false is about the worst they'll ever hit this guy with. And it wasn't just PolitiFact. The Medicare chief came out and said that Cuomo's nursing home order did not follow federal guidelines in any way, shape, or form. And then the next thing that people say to me whenever I'm trying to talk to people about this situation is that, oh, well, it never happened. That was the policy, but no patients were moved in. Absolutely untrue. The AP has counted over 4,500 patients that were sent into nursing homes just in New York State. Imagine. And so again, like in so many circumstances, we see somebody on the other side of the aisle being praised even though they've made blatantly poor choices. And I mean, people were floating this guy's name for the possible presidential nominee. Knowing everything we know now, I want you to watch this interview.
Governor, House Republicans are looking into New York's March 25th order that directed nursing homes to take in infected patients. This thing is not going away, sir. 6,300 people died in New York nursing homes. That is the most in this country. The more time has passed, the more your office has been able to look into this. Do you take responsibility for that order and the role it may have played in those deaths?
Yeah, the Republicans definitely are playing politics. They don't want to talk about how they are now handling this COVID virus. Yes, I understand that. And there are facts also, Stephanie. So let's look at the facts, right, rather than the political rhetoric. Yes, we had more people die in nursing homes than anywhere else because we had more people die. Because the federal government missed the boat and never told us that this virus was coming from Europe and not from China. And January, February, March, before they did the European travel ban, 3 million people came from Europe and brought the virus to New York. And the federal government didn't know, and the federal government and the CDC and all of them failed to handle this pandemic and warn this nation. So New York had more cases, more deaths, and more deaths in nursing home because that's who the virus affects. It affects senior citizens. We know that. You look at any state, and they had a tremendous number of deaths in nursing homes. It's all a political charade, and it's an ugly one, frankly, to talk about a number of deaths and suggest there was politics at it. The number of deaths are still going up, Stephanie. Look at Florida, look at Texas, look at Arizona. Let them look in the mirror and say, you know what, we were wrong. We're killing people unnecessarily by this irresponsible, reckless reopening, and it's not working for the economy either. Those are the facts, Stephanie. There are still facts and truth in life, even in this political mayhem that this nation is in.
Sometimes I look at these interviews and I think to myself, man, did I used to believe that shit? I don't know. It's a possibility. But what just happened there? She asked him a straight up question, are you interested in taking responsibility for that order? And what did he do? Blamed other people for playing politics, diverted the attention to other issues, and then used fear of a future reopening wave to obfuscate the question that he never answered. And so there you go, folks. Andrew Cuomo's decision to move CV patients into nursing homes. Everyone's fault but his. Anyways, guys, I got more content coming out probably tomorrow. Like, share, subscribe to my channel. I love y'all. Peace.